With me now is Dr. Marla Shapiro, CTV's medical specialist. So let's talk about this new modeling data. It just came out. We're all trying to wrap our minds around it. But one of the headlines is that wastewater shows cases peaked around January the 4th, which would correspond to a peak in cases around January the 11th. What do you make of what we've heard so far from the modeling data, Marla?
So cautious optimism, but we got to where we got to because of public health strategy. And we do know that if we relax all those strategies, we will see an uptick in hospitalizations. We will see an uptick in ICUs as well. So it's not only hospitalizations, it's what's happening within the community, family practices, accessible care. So it's with cautious optimism that we see that we're reaching a plateau. But I think we have to tread very lightly in terms of easing restrictions and not wanting to lose the momentum of the decline and suddenly see an increase in uptick of cases.
All right, let's turn now to Pfizer's approval in the United States of a vaccine for 5 and younger. What do we know about this vaccine?
Yes. So, again, it's very interesting. The vaccine is 1/10 the dosage. And in children between the ages of 6 months to 2 years with a 2-dose strategy given 1 and 3 weeks apart, they did very well. Between 2 and 4, they did not mount as high an immune response as was wanted to see. And we began to think about a 3-dose strategy, which would be time 0, 21 days, and then a couple of months later. And, there was a suspension of let's get more data, but we're recognizing that even with the 2 doses across that spectrum, it really blunts the severity of disease. And we've seen increases in hospitalizations in ICU in children under the age of 5. So I think there's a great momentum to get the vaccine out there, recognizing that with a 2-dose series, it will certainly blunt the severity. It may not spread the transmission. We may need to amend the protocol to a 3-dose protocol. But I think there's a great urgency to try and want to get vaccines out to children between the ages of 6 months and 5 years.
But at the same time, Marla, if the Omicron wave is peaking, I think a lot of people are going to say, well, maybe we don't need to vaccinate children 5 and under. We don't need to do that for our kids.
Well, I don't think that's what the data is showing us. We've seen a great increase in hospitalizations in these kids. And yes, it's milder disease because it's mostly upper respiratory. But don't let that word mild fool you. When you have so many in the population who are impacted, you do see those who don't do as well. So blunting the disease, attenuating the severity of the disease, I think is something that's wanted across the spectrum of age from 6 months all the way upwards. And I think that the 2-dose series does offer that. And it may be that the 3-dose series actually prevents the transmission as we saw in adults. So recognizing that this ultimately may be a 3-dose series, even in children under the age of 5. We'll have to wait and see what the data shows. But I think that the data does show us that we do see a lot of disease in children under the age of 5.
All right, Dr. Marla, we're going to have to leave it there for today. Great to see you this morning. CTV's medical specialist, Dr. Marla Shapiro.